Hello, Dan Luxka here from Instacare Physical Therapy. I'm going to give you a brief overview of dry needling, a popular treatment technique for musculoskeletal issues. So what is dry needling? Dry needling refers to the insertion of thin monofilament needles, just like the ones used in acupuncture. These needles are referred to as dry because they do not inject any substance into the body, unlike hypodermic needles. So what structures do you target with dry needling? The old definition of dry needling refers to inserting needles as an intramuscular procedure, as in muscular trigger points. The newer definition includes muscular trigger points, but goes a step further. An extensive body of literature, including both peer-reviewed articles and randomized controlled trials, support the insertion of dry needles throughout the body at non-trigger point sites as well, for the purpose of reducing pain and disability in patients with neuromusculoskeletal conditions. The other structures targeted include ligaments, scar tissue, tendons, bone, and tenoosseous insertion sites, all of which are types of connective tissue. So how does it work? Well, there are a number of biochemical, biomechanical, endocrinological, and neurovascular mechanics behind the anti-nociceptive and anti-inflammatory effects of dry needling. One way dry needling works is it activates opioid-based pain reduction mediated by the sympathetic nervous system and activates non-opioid pain reduction through serotonin and norepinephrine from the brainstem. Dry needling reduces inflammation by inhibiting COX-2 enzymes, which in turn reduces inflammatory cytokines. Dry needling can reduce pain with electrical stimulation by reversing hyperalgesic effects by normalizing nociceptive channels. Electric dry needling stimulates fibroblasts, which aid in tissue repair and alter the stimulation of certain receptors to reverse hyperalgesia. Now that we have established several of the ways dry needling works to reduce pain, decrease inflammation, and aid in the recovery process of musculoskeletal conditions, let's discuss how it is different from acupuncture. Both use monofilament needles, but the terminology, treatment protocols, theoretical constructs, and philosophies are all different. To break it down further, acupuncture is an Eastern concept that claims to move qi or energy through meridians in the body. Needles will be placed along these meridian channels, which may or may not be placed near the site of pain or injury. Usually, the insertion of needles are relatively superficial and may be in place for 30 to 90 minutes. While dry needling focuses on the insertion of needles at the target tissue of the injury or painful location. They also may be inserted deeper in the body to reach the muscle belly itself, such as the piriformis for piriformis syndrome. Electrical stimulation is often used, and most protocols are between 10 and 30-minute treatment sessions. Different techniques are also used with the insertion of needles, including a fanning technique, tenting, and twisting technique to better stimulate the tissue for its therapeutic effects. So who would benefit from receiving dry needling treatments? High-quality studies show that individuals with knee OA, low back pain, whether acute or chronic, neck pain, shoulder impingement, piriformis syndrome, plantar fasciitis, IT band syndrome, meniscus tears, muscle strains, migraines, tension-type headaches, chronic pain, and individuals with spasticity all benefit from dry needling treatments. It is important to note that dry needling should be combined with exercise, joint mobilizations, and hands-on soft tissue work to be fully evidence-based. For individuals who cannot tolerate exercise well due to high pain levels, dry needling is another great way to reduce that pain in order to tolerate those evidence-based exercises better. The side effects of dry needling may include bleeding, which is uncommon but similar to having your blood drawn, where you usually only see a drop or two. Bruising, when it does occur, is usually the size of a dime over the insertion site. Pain may occur during or after the treatment, but is temporary and rare. So how safe is dry needling? Comparing dry needling to opioids, NSAIDs, and manual therapy for the goal of pain relief, it is the least likely to have a minor or major adverse event. What does a dry needling session look like? It would first be determined with the patient where their pain or dysfunction is stemming from. Then the dry needles will be inserted at the specific target tissues. The needles may be spun or wound up to grab more of that tissue, and electrical stimulation may be attached to those needles for the desired amount of time per protocol. After the treatment session is over, exercise or other hands-on treatments may be performed. Here is a summary of the key points made in this video. 1. There is a plethora of evidence, including systematic and Cochrane reviews, to support the use of dry needling for musculoskeletal conditions. 2. Dry needling helps to reduce pain, reduce inflammation, and speed up the healing process. 3. Dry needling is different than acupuncture in its approach to treat musculoskeletal conditions, although they use the same type of needles. 4. Dry needling should be utilized in conjunction with exercise, joint mobilizations, and soft tissue work when appropriate for best results. In conclusion, dry needling is safe, effective, and efficient. Thank you for watching this video on dry needling by Instacare Physical Therapy. We have 3 convenient locations for our one-on-one treatment sessions in Chester Springs, Exton, and Westchester. Please feel free to reach out to us with any questions about dry needling and how it may help you reach your goals of a pain-free and active life.